Okay, so this is a short talk on peripheral neuropathy. You need to have a good overview of peripheral neuropathy as part of your DM Part 1 preparation. So as usual, we'll start with a case. A 54-year-old male patient presents to the emergency department with pain in the hands and feet, which he describes as burning. On examination, he has loss of vibration sense in his hands and feet, but his reflexes are intact. So just pause the video and think about causes of this presentation, and then we'll proceed. So what's the likely diagnosis here, and what are the underlying causes of this condition, and think about what further tests should be performed. Okay, so this is an example of peripheral neuropathy, which is a condition that affects peripheral nerves and tends to affect them from more distal to proximal. Peripheral neuropathies may be sensory or motor combined. I will come to that. And in our population, probably the commonest causes are diabetes and alcohol. Again, pause the video and see if you can think of a list of other causes of peripheral neuropathy. So here's a more comprehensive list. Think about systemic diseases such as diabetes, renal failure, vitamin B12 deficiency, malignancy, hormonal diseases such as thyroid disease or Cushing's disease, exogenous causes, idiopathic causes such as Guillain-Barré syndrome, various infections, autoimmune disease. And just to go into a little bit more detail, some of the drugs that cause peripheral neuropathy would include anti-tuberculosis drugs, phenytoin, specific types of chemotherapy, particularly cisplatin and vincristine. Some antiretroviral drugs also cause peripheral neuropathy. And the toxins that may be related to peripheral neuropathy include alcohol, heavy metals, and certain organic compounds such as organophosphates. So we can classify neuropathies according to which nerve is mostly affected. It might be primarily motor neuropathy. Many of them have a sensory component or are pure sensory neuropathies. And then we have some peripheral neuropathies that affect the autonomic nervous system primarily. Of course, we also have mixed neuropathies which involve motor sensory and autonomic nerves. Pure motor neuropathies are less common, but some of the causes would include Guillain-Barré syndrome, poisoning, particularly lead poisoning, and certain infections such as Lyme disease and leprosy. We can also classify neuropathies according to their patterns. So you have mononeuropathies in which just one nerve is involved, and this is often due to a mechanical cause such as nerve compression, but can also be due to other things, vascular causes and immune causes. So for example, diabetic vasculopathy is one of the more common causes of mononeuropathy. You may also have something called mononeuritis multiplex, which we will discuss in more detail in a bit. And commonly you get polyneuropathies where multiple nerves are affected simultaneously, and this often affects the more distal part of the nerve, the hands and feet, and then move proximally. And as we said before, this could be sensory, motor, autonomic, or mixed. Let's go to another case. A 25-year-old male patient presents to the emergency department with weakness of his left hand and arm after sleeping badly on a chair following a night out on the town. On examination, he has a wrist drop and numbness over the dorsal skin of the first interdigital space. See if you can figure out what this is. Okay, so as you may have guessed, that was a Saturday night palsy, which is compression of the radial nerve in the axilla. You can also get compression of the radial nerve at the elbow, something called Honeymoon Palsy. Compression of the medial nerve at the wrist, which is carpal tunnel syndrome, or compression of the superficial peroneal nerve at the level of the neck of the fibula with a tight cast. This table shows you some nerve injuries that may be associated with specific orthopedic injuries and dislocations. Just to note, this is a really common type of question, both in the written exam and in the oral exam for your DM Part 1. Let's move on. A 54-year-old female diabetic presents to the emergency department with diplopia. She tells you that 1 month ago she developed a foot drop and that she currently is also experiencing weakness of grip. On examination, the patient is found to have a left third nerve palsy as well as a right radial nerve palsy. She also has a mild left foot drop, which she said is almost recovered. So again, pause the slide, think about what this might be, and think about the causes of this condition. So this is very typical of mononeuritis multiplex, where you have multiple mononeuropathies occurring either simultaneously or sequentially. The nerve trunks are involved, so the entire nerve is taken out, and this tends to be non-contiguous, in contrast with Guillain-Barré syndrome, which tends to be contiguous and ascending. By far the commonest cause of mononeuritis multiplex is diabetes mellitus, but other causes include vascular disease, autoimmune disease, demyelination, and certain infections. Move on to case 4. A 48-year-old patient with type 2 diabetes who presents after a blackout and is found to have postural hypotension. On further questioning, he admits to impotence, spurious diarrhea, and urinary incontinence. Again, just think about what might be causing these symptoms. So, this is an autonomic neuropathy. Diabetes being again the commonest cause, but it can also be seen with Guillain-Barré syndrome, autoimmune disease, and certain infections, such as HIV. Common clinical features include cardiovascular, genitourinary, and gastrointestinal symptoms. Our final case is a 38-year-old male with COVID-19 who develops tingling of his hand and feet and then a progressive weakness of his limbs. This, of course, is Guillain-Barré syndrome, which we talked about before. We need to know a little bit about the pathophysiology, etiology, clinical features, investigations, and treatment of this condition. So if you have any questions, we can discuss them in class. In summary, peripheral neuropathies can be divided into mono and polyneuropathies, or categorized according to which types of nerves are affected. Thank you.